We do have another question. Um, and maybe Brooks, you can speak to this around where to go in like the Summit County Park City area, but where do you go to get EMDR assessment or treatment?
I feel like that's not a question for me, actually. I feel like that might be a better
I think I
question.
can answer that.
Yeah, I was going to
Yeah.
say.
All right, go for it.
So, yeah, so we get a lot of requests for that. And if you go to Psychology Today, you can actually, there's a drop down in a filter area where you can look for EMDR specifically, and then that provider has been trained and you can then ask further questions about it. I also was trying to jump in there when everyone was talking about the new treatments, but the psychedelics have also been requested, some ketamine questions, that kind of thing. So there's always something new. It's very exciting. I think the way they're looking at treating these traumas at a more neurological level, you know, getting into those cells, like you said. Yeah.
I have to jump in super fast and just say something about the psychedelic assisted psychotherapy. I'm a certified psychedelic assisted psychotherapist. I have been for a few years. And obviously I'm a fan of psychedelics. They're not for everybody. They're not for everybody, and they're not a magic answer. And in fact, under psychedelic assisted psychotherapy, you're not going to get answers. If anything, you're going to get the questions that you have to work on with skill therapy. There is no magic answer in magic mushrooms, although I'm a huge fan of mushrooms, of ayahuasca, of ketamine even, but we have a long way to go in making a good clinical outline and program. We'll have to watch and see what our friends in Oregon do. There's a bill in Utah right now about psychedelic assisted psychotherapy, but it's so important that people know that that's not an answer, and the real work has to be done with real therapeutic clinical interventions after, because psychedelics are not the clinical intervention.
Oh, absolutely. Yeah. No, it's not, any therapy is always the answer for everyone. You kind of have to experiment and figure out what is working for you and what touches you and that works. So yeah, I agree. But it's very it's interesting to me. I love reading about it, and it is showing a lot of promise for people with resistant depression. So, and the veterans. So.
Jackie, thank you so much for jumping in. I think I'm just going to go take a break because this panel's just going on its own here. It's such a fascinating. There's so much to talk about. I am going to jump back though, and let's see, Evan. I'd like to know a little bit about, is there a higher percentage of opioid use versus other substances in the populations that you serve? And if so, why?
So opioid, like amongst the people that we serve with substance use disorders in Utah, I mean, opioids are incredibly common because they're prevalent and addictive and powerful. We also see quite a bit of amphetamine use, like methamphetamine, for example. It's incredibly common, especially in some of the more rural areas of the state, because it's more accessible, it's more affordable. People prefer that substance, and so really, I think the kind of top ones that we see for sure, and like in terms of the profile of people that have a substance use disorder, are methamphetamine, opioids like heroin or fentanyl, and alcohol is still a tried and true substance that people use problematically or chaotically. Mm-hmm. And just while we're on the kind of subject of treatment, I wanted to point out that kind of tie back just more broadly to the treatment of substance use disorders and not just specifically to trauma, because we kind of got specific to trauma there for a second. But when I think about recovery from substance use, I really look at improving what we kind of talk about as a person's recovery capital. So all the different external and internal resources that person has available to them to sustain a life in recovery over the long haul. Right. And so that can be a lot of different things. It can be some of these kind of like psychological resources, like healing your trauma, but also can be more physical things like, do you have access to transportation? Do you have the means to attend recovery groups? Do you have a social support system in your life? So sometimes we also have to kind of take a look at some of those more concrete elements of what can be going on in someone's life that might be a barrier to them finding and maintaining long-term recovery themselves.
Thank you. Mindy, can you tell us a little bit about, first, can you define for us harm reduction, and then why the Utah Harm Reduction Coalition was formed?
So harm reduction is, I think most of us that practice harm reduction use the National Harm Reductions definition, which is it's a practical set of strategies that are used to minimize harms associated with substance use. People also use it in relation to sex work, but people in general use harm reduction every single day. Sunscreen is harm reduction, seatbelts are harm reduction, calling an Uber when you've been drinking, that is harm reduction. So even though people tend to be adverse to the term harm reduction, we all use it all the time. And then what was the second part of the question? Oh, why we were started?
Yes, why did you form?
So I started UHRC after my sister died from an opiate overdose. So I lost, almost 8 years ago, I lost my big sister Malene to an opiate overdose. And at the time I was a practicing clinician. I was the residential program manager for First Step House. I had been in recovery myself for 7.5 years when my sister died. And at the time my sister died, my little brother was still addicted, and everything I tried to do to help him was the wrong thing. And, you know, if I put on the clinical hat, at the person in recovery hat, no matter which hat, it was always the wrong hat. And it was because I didn't just ask him, what do you need, Stan? What can I do to help you save your own life? And that's when I just realized that there's just so many ways that we alienate people in treatment, and that we could be doing better at saving lives. And so that same year, the syringe exchange, well, the next year, the syringe exchange law passed, and I started UHRC. One of the biggest motivating drivers for me is, as a treatment professional, I have sat at many a treatment table, many clinical team meetings, and fought with another clinician about somebody's worthiness to stay in treatment. And I will never do that again. As long as someone wants to change, as long as someone wants to engage in treatment, I don't care. I will help them. That is what I went to school for. That is what I believe my ethical obligation is. And the only way that I can truly do that is to start my own organization and say, no one's going to keep me from helping anybody ever again. And so that's when I started UHRC.
Fantastic, and thank you for sharing that. I appreciate your honesty. Doing a question check-in. I see, you know, the chat's blowing up a little bit. Betty, anything?
Chat's blowing up. Our panelists are totally involved in the chat, and it's awesome. But it doesn't seem that there are any like questions. Just a lot of awesome conversation happening.
I love what Natalie said. I just have to comment on this when it says there's so many people dealing with abuse and trauma issues. She's glad there's no longer one canned answer as to where to go and how to approach recovery. Because when I got sober, you know, God bless the treatment centers I went to, they did change my life, right? But they beat the hell out of me. You know, like, I mean, I almost got kicked out of treatment at the House of Hope, which would have meant me going to prison and losing my son for smoking a cigarette. No one should go to prison for smoking a cigarette. Like, that's insane, right? But that was like how we did treatment. It was, you know, you just beat people and you abuse them until their behavior changes. And thank goodness that's not what we do anymore. Thank goodness we've looked for all these other pathways. And like Evan talked about, like, what is it that literally is driving this person to use? But not only that, what is getting in their way of being able to recover? You know, when you tell people that they have to reach, it's like when you tell somebody to pull themselves up by their bootstraps, but they don't even have any boots. It's the exact same kind of thought process, right? And substance use is the only kind of treatment that we require the outcome before the work's been done to get there. And I hope that at one point, that's the part that changes, that we start engaging people and working with people to help them heal before we expect them to have the behavior of being healed. And that's coming. It's coming. We're moving along there.
I also just want to reflect just briefly, Mindy. By the way, I'm Mindy's biggest fan. I serve on her board, just full disclosure. But
I'm Evan's biggest fan. That's why he's on the board.
There was a time where this conversation would have been much more contentious, because prevention plus harm reduction plus recovery, like there's no way that we would get along. But now we're seeing that we're not all that different. Like that prevention is recovery, is harm reduction, right? It's all the same thing. We're all trying to work to save lives and reduce suffering.
Mm-hmm. we are going to have to move on to our next topic here, but I want to throw this out here because it relates to mental health. So how we deny people the medication that they need for mental health while in recovery because it's a substance. So is that changing? Is that going to change? No, Mindy says, no, it's not. All right.
It's not changing. It's UHRC is the only treatment center that allows people to come into treatment on some kind of benzodiazepine, because whether people like it or not, somebody with a severe anxiety disorder, it might be medically indicated for them to take a benzodiazepine. And guess who doesn't get to decide that as a clinician? Me. You know why? Because I don't practice medicine. I might be a professional in the field of addiction, but I don't practice medicine. Right. And we don't even allow people to check into treatment on that kind of medication. Adderall, people who, it's very rare if somebody can come into residential treatment on some kind of opiate for real chronic pain use. And nobody, there's only 2 treatment centers, UHRC and Altium Health, that allow people with medical cannabis to engage in substance use disorder treatment. And that is just wrong, and asking somebody with ADHD to focus in groups. I have ADHD anyway, but people that are more normal than me, they have a hard time focusing in groups, especially when they're 2 hours long and the group's not about you, it's about one of your friends. But if you fall asleep in group, do you know how much trouble you're going to be in? In some treatment centers, you'll be kicked out, right? But yet we don't allow people to take medication that would work for them. Instead, the only medications we let people take are, well, maybe you can take a non-narcotic medication, when a narcotic medication would actually be the appropriate medication. But we just group everybody into one little ball there. And we also assume that somebody who has abused one substance will misuse all substances. And that's not true. That's not true even amongst people who are in active addiction. When I was shooting meth, people would pull out cocaine around me and I never used it because I don't like cocaine, And so to say that people abuse all substances, that's just not true.
Right.
And we're denying people much needed help and treatment for stupid reasons that have no scientific backing whatsoever. And it's costing people lives, and it infuriates me. I'm going to be quiet now.
I would agree too that we're nowhere near where we need to be on that issue. Although I do want to acknowledge some of the small steps we've made in the right direction, right? There used to be a time when we would say things like a drug is a drug is a drug, right? And how damaging was that to people on run-of-the-mill antidepressants, right? We would say like, well, if you're on antidepressants, you might as well be smoking crack. And those are not at all the same things. So we've made a little bit of progress there. Also, I think in terms of our utilization of medication-assisted treatment in the opioid space, we've come leaps and bounds from where we were. That same kind of drug is a drug thing used to come up in the treatment of opioid use disorder, because people would say, why would you give someone with an opioid use disorder an opioid to treat their opioid addiction? But now we're seeing the use of medications like methadone and Suboxone and some of the kind of newly developed medications that are incredibly popular because they are highly effective, and they've been shown to be evidence-based, and they save lives all the time. And so luckily we're seeing that become more and more mainstream, largely because we had, I think, some changes in federal law that led the way around that. But so I think some small wins are worth celebrating too.
Absolutely, Evan. No, I'm glad you brought that up. And now my phone's blowing up with some questions here too. So I will throw out a few questions here, and then I really want to focus on some solutions. And Evan, you just jumped into that. So let's answer some audience questions, and then let's start talking about how we can make some positive change in our community. The first question is there work with individuals that are seen for trauma therapy prior to turning to substance abuse, being given tools to avoid self-harm? Is there work with individuals that are seen for trauma therapy prior to?
Are they asking if they're being given coping skills to avoid substance use in the first place?
Yes, I believe that is the question.
I feel like that's the winning answer. I feel like if we did that with kids when they're younger and taught them how to talk about emotion and taught people coping skills and communication skills, we'd be a lot better off.
Yeah, if I had ever been screened for my history of trauma as a kid, I think that someone would have identified that I was at a high risk for substance use, and that would have cut out a lot of suffering in my life. But we don't screen for trauma, and we really should.
Well, and we have another question that piggybacks on this. And Mary Christo, this one's for you. And it's someone who's saying, when I was a younger parent, conversations like these were thought to plant a seed. Can Mary Krista address how and when to have these conversations with our kids?
I appreciate that question, Natalie and Betty. It's such an important one. And, it's a myth. It's a myth that having these conversations plant seeds. We know this. It's the same when it comes to conversations around sex, conversations around mental health, conversations around substance use. And we continue to get pushback around having these kinds of conversations. One of the ways that shows up is every 2 years, our SHARP survey goes out to youth in grades 6, 8, 10, and 12, and it asks questions about self-harm, mental health, substance use. And every time we get questions and pushback, why are you asking my 6th grader about cocaine? You're planting the seed. And I can just say all the data, and all the work that's been done in this field shows that having conversations, age appropriate, but early and often, absolutely are preventative in nature. And to destigmatize it, one of the things I'm really enjoying hearing from all the panelists today is this movement way out from black, white, good, bad, all or nothing, and opening up this conversation to the richness that exists there so that we can truly listen to one another, have that connection, be able to talk about and ask for what we need, for the help that we need. And, I know that a lot of parents feel shame when their kids are struggling, and they suffer in silence because they are afraid of being judged by their peers. And I know parents who are afraid to call for help if their child has drank too much or taken substances, even if they're having some kind of critical mental health event, because they're afraid of the legal consequences that might flow from that phone call. And so I think this is an incredibly important conversation. And in my own personal life, I lost my brother-in-law at 23 to a heroin overdose. And my kids were 2 and 9 at the time. And you can believe that we've been having conversations about substance use openly and honestly every day since then, because they bore witness to the really terrible consequences in our family. And so I've never personally had to wonder about that. We talk about it all the time.
I just want to piggyback on that really quickly, because I was an addict and my son, he was almost 7 when I got sober. And then my daughter was 4, almost 5. She was like a month or 2 from her 5th birthday when my sister died of a heroin overdose. My kids didn't have the luxury of not having honest conversations about substances. And we don't have honest conversations about substance use. We continue to perpetuate the lies of the DARE program and that there's somebody with a snake head that's selling crack down on the corner to 9-year-olds. And that's just not true, and because I've had the opportunity to have honest conversations with my kids about substance use, their relationship and ideas about substances are so different than other kids. My son just turned 21 on Saturday, and we went to Vegas, and he had a few responsible drinks. He just has no desire to do that. And in fact, he knows that if he's using a substance when he's emotionally distraught, that he's putting himself more at risk and not be able to handle his own life. And he doesn't ever want to go there. And that's a direct result of being able to have honest conversations with him about what really happens with substances, both good and bad.
Yeah. I think also one of the things that I find parents say, I can't possibly talk to my kids about drugs and alcohol because I've taken drugs and I drink. And they feel like, oh, I'm being hypocritical. And my response to that is get over it, because they need to, the more informed we can be, the better we will all be. And the the idea that people aren't, if I don't talk about it, it'll go away, or if I let them know that I've done these things and they're going to look at me differently, you know, there's just so many lies. And really, we want to educate our children, but parents need to be educated as well. You know, as a community, we all need to be educated on what is actually going on. And I think I remember being at someone's house and having them say, well, you know, my husband and I never took drugs, so we know our kids won't take drugs. I was in this person's house. It was a good thing they weren't at my house, because I would have kicked them out. I mean, I joke, but like, that is a really naive point of view. And I don't fault the parents for being naive, but that is not helping the situation in the least. You know, we all need to understand this is happening. And so what do we want to do about it? And with the understanding that it's not happening in a vacuum, it's happening in response to our world. And that's okay. You know, that's okay. There's no shame in that, but let's work towards solution. And so if parents are confused about how to talk or whatever, just, you know, try. And I would also want one other thing I would say, and we've talked internally about this, is that just being present and talking to your kids is a huge way of preventing this type of alienation, isolation, and then substance use disorder. Like, it really is being connected with our kids. And sometimes you don't want to be connected with teenagers. That's just, and they don't want to be connected with us, but we did try.
So I have a question then. You know, I'm so thrilled to hear that there's, what is it called? Fit to Recover. Okay, never heard about that. I think we need more sober events in our lives to really create some changes in our communities. But, you know, even going to a sober event has stigma attached to it. So do any of you have some perspective on how your clients or parents or kids would react to our community being more sober-minded and putting it out there and saying, hey, we're going to go and we're going to have a blast, we're going to have a party, there's not going to be any drugs or alcohol, but we're going to go and have fun. How would that be perceived by people you know?
I personally have had situations where people are like, how do I possibly go to a concert sober? Like, there's no way. And I've gone to Dead and Company. I've been to all sorts of shows sober. And of course, I mean, you know, music is music, and music, as I said earlier, you know, is affecting my brain and giving me positive endorphins. It's kind of like you just have to, say, you know, this is going to be an amazing thing. I think if we label something as a sober event, my people would be like, I'm not going to that. That sounds totally boring. Right. But if we can say, you know, what is the point of, what are we doing? Because there's lots of things we do sober, you know, right. Lots of things we do sober. We just don't maybe say that we're sober doing it. If you go to yoga, you probably go to yoga sober, for example. So we don't have to have a sober yoga event. We're just doing yoga.
Can I jump in?
Please.
You know, this is, you know, at the heart of prevention work at the community level. This is the question I'm most curious about from a culture change perspective. And I think it can be done in large and small ways. It can be done in the decisions that we make as adults for the kinds of, you know, parties that we host and gatherings and social interactions that we provide, fundraisers that we host. You know, we don't have to name this is going to be a sober fundraiser. We can just have a really fun, lovely time together and simply not provide alcohol. And I also think about our culture change in our community when it comes from a business perspective. I have a close friend who works in tourism, and she would say that going to all the tourism events that she goes through throughout the state and the nation, the way in which Park City positions itself is you can get a drink here. Make no mistake, you can get a drink here. And so that, you know, our tourism economy is built around this come, party, drink, have a good time. You can do this in Utah. And it goes all the way back to the founding of Park City, which is a mining town, whereas most other cities in Utah were founded by Mormon pioneers. So we've always kind of stuck out along with Moab in that regard. And so I don't have all the answers. I do agree that, we don't have to call it sober, although it might be helpful at times, especially for people who are wanting to have a connection in a place that they know there aren't going to be substances there. So I think there's a mix of both. I always joke that I wanted to open a bar called the So Bar and just have mocktails and great music and dancing, Brooks. So that's, if I had more time, maybe that's what I'll be doing.
Yes, you did
Excellent.
your job. Get going on that, Mary Krista.
And we really do need to have like many prongs on the fork of things that get people engaged that they want to do. I feel horrible because as a clinician, like back in the day at First Step House, right, which is an all-male facility. So I had lots of men who were like, oh, I'm going to get sober going to the gym. And I used to tell them all the time, the gym's not going to keep you sober. Well, one, I was wrong. Two, I also put them in a position where their honest idea of what their recovery was going to be, they couldn't really be honest with me about that because I shut them down, because I was sure 12 steps was the only way to go. But you can see it even if you go, like, I'll just use 12-step groups as an example. Like, depending on what somebody's drug of choice is, they're very different in their ways of liking to have fun. Like, you would think the alcoholics are wild. No, if you go to an AA event, they are all in bed at 10 p.m. It is straight crickets. If you go to a Cocaine Anonymous convention at 4 a.m, they're running down the hallways with Red Bulls in their hand. You know what I mean? So like, we really have to create different kinds of events for different kinds of people who have struggled, because not somebody put over here, I'm one of the boring ones or something like that. We have to accommodate everybody so that everybody has a place that they feel at home. So Cheers feels like it's everywhere, not just in the bar.
Oh, that's
Only
it.
half of us even remember
Point.
Cheers.
Yeah. No, that's such a good point. Yes, very good point. The final topic I really want to touch on at the moment is how do we get more involved? How do we stay on top of the legislation that needs to be passed to help each other? Where do we go to find this information? What can we be doing? Share some, enlighten me, because I need to be more active. So that we can have this a better world to live in. So where can we go? Evan, do you want to start with that?
Sure. So at USARA, one of our major kind of like functions is an advocacy organization. And so I also serve on the Substance Abuse and Mental Health Advisory Council for the state of Utah, which helps inform the legislature and the governor on potential legislation and how it might affect people with substance use disorders or mental health conditions. And I just kind of do that as a citizen. But I saw earlier some Connect put a bunch of links in the chat to current legislation that's under consideration this legislative session, because we're right now kind of just smack dab in the middle of our part-time legislative session here in the state of Utah. And I would say that the best way for anyone to get involved is to, if you haven't tracked a bill up at the legislature before, find a bill, any bill, one that you're interested in. It doesn't matter if it's substance use related or not. Just find one thing and just track how it progresses so you learn the system, right? And then I would also advocate that you reach out to your elected officials, so your Utah House of Representatives member and your state senator, and just form a relationship. Just say, hi, I'm so-and-so, I live in Park City, and I'm one of your constituents. That is one of the most powerful things you can say to an elected official is, I'm one of your voters, because you're in charge of whether or not they keep their job. So I would definitely encourage you to start forming those relationships, start having those conversations. Make sure that your legislators know what kinds of issues matter to you as an individual voter, and get involved about issues that you have passion around. Like it doesn't have to, like I said, be connected to substance use or mental health. It could be something else, but it's your passion that's going to start changing the conversation up there, and it's your passion that's going to see change happen in the world.
All right.
And there's lots of organizations that track these kind of bills, so you don't have to reinvent the wheel. There's, organizations, if you're passionate about the kind of work they do, I guarantee you they are tracking those bills somewhere. And usually you can get like a list from organizations to follow. Evan would know a whole bunch of them because I actually usually get my bill tracking sheets from Evan. So this is how I know this works. And then also you'll learn to see that there's certain legislators that are friends of some of our causes, right? So you can guarantee that they're going to be the legislators who are putting forth legislation that matters to us. Also, they are legislators who are willing to run legislation for us, because you have to remember, legislators, they're just like me and you. They are no more or no less than anyone here, even though sometimes when you meet them, you might think they think otherwise. But nonetheless, they're just like the rest of us, and they're not experts in the things they're passing bills in. And they rely on expert opinions, expert information, and information from their constituents so they even know about these issues. We can't expect any one person to know about everything that's important.
That's true, yes. And that is excellent, keeping, just knowing who to go to. And I'm sure that part of our follow-up with this panel is going to be listing even more than we may have listed with some of the bills that there are links to in the chat, but we'll list organizations that help support this kind of change in our culture. So finally, I want to ask I want to ask you, are there podcasts and books and things of that nature that you all would recommend that are must reads if you're interested in the topics that we've been talking about today?
I would just start with my favorite parenting podcast by Dr. Brad Reedy. You can find it on SoundCloud or iTunes under Evoke Therapy Programs. And I just appreciate his open, non-judgmental approach. And it's a wonderful resource for parents of kids who are struggling, parents of kids who aren't struggling. And it really invites the parent to be self-reflective for themselves instead of trying to control another. And I deeply appreciate his work. And he's in Park City tonight at a small event. So if you're interested in attending, I've had a couple spots open up today, and you can text me or email in the chat, and I'll send you the link.
Well, that's fantastic. Great. Does he
Well,
talk
very
about
exciting.
children who move back home in their 30s?
Yes.
That is it's becoming a bigger topic in our society, isn't it? Anyway, I jest. Go ahead.
Oh, I was gonna say, I referred someone to this gentleman's event tonight. Right. Yeah.
Oh, thank you.
It's nice that you let us know so we can tell other people when it comes up. That's great. Thank you.
Fantastic. Any other must reads or listen to? No? Okay. Well, I think we're going to, let me ask one more time here about questions. We can open this up to questions right now. Betty, are you still there?
I am here, my dear. That rhymed. So I'm looking through the chat. Sorry, I know that there were a couple of questions. One of the ones that we had earlier was, how does this information and mindset move to mainstream healthcare? And the context around this is, my family member was released from 2 different ERs in Salt Lake in the same day, obviously psychotic and under the influence. They sent him to VOA Detox, Volunteers of America. Is that what that would stand for?
I think that thankfully we're starting to see some progress on that issue, but traditionally physical health and then behavioral health have been separate kind of entities. And even within behavioral health, there's mental health and substance use, which have also been separated. And so, but we are starting to see a shift towards more integrated care. One of the efforts that we've seen recently happen to address that is our organization, USARA. We now have peer recovery coaches who are able to meet with folks in acute care settings like hospitals and ERs. So in Salt Lake County now, and also we're piloting it in Weber Weber and Washington counties, those local hospitals are able to reach out to us if they have a patient show up with either a acute detox or overdose or any sort of substance use related crisis. And they will ask that patient if they want to speak to a person in recovery. And if they say yes, we have a 24/7 on-call number that those providers can call and get a hold of one of our on-call peer recovery coaches who will come up and visit with that patient in person and help get them the resources they need for whatever is coming next in their journey. And we don't have any preset idea about what that's going to be. We really let that person kind of dictate what their next steps are going to look like, but we want to make sure that they get to the next step, whatever it is. So for some folks, it's something like harm reduction resources. So we're connecting them to Mindy's organization or to syringe exchange services, or just giving them a naloxone kit to prevent for future overdose. And for other patients, it might be something like connecting them to a treatment center or a detox facility and making sure that they get and stay there. Because often what we were seeing happen in hospitals and other acute care settings was that the doctors really want to treat that patient for what's going on in that moment, what's killing them right now, and then get them moved on. So as soon as we've addressed the immediate concern, we're discharging that person. So we came in and said, we really need to focus on what's happening next in their journey so that they don't come back to the ER. And it's been really effective to work with patients as people in recovery and say, what can we do for you? How can we make sure that you get to the next stage in your care, whatever that looks like for you?
I love that. And I would just, that is so spot on. And I think that I want to add that it is self-advocacy and helping people to have agency over their own journey. And that's really hard, especially when people are very, very ill. It's difficult. So we need to also advocate for our friends and family who might be suffering from any of what we've been talking about today. But the way to move the needle or move the ship or right the ship or whatever metaphor you want to use is by being loud and asking questions and research and saying, well, I read about this, tell me about this, with our own doctors, with our therapists, with friends and family, and then in the hospital setting, not just to take the doctor's word for it and not just go with, the diagnosis might be one thing, but the prognosis we don't necessarily have to accept. And that's important. I think self-advocacy is key, and then helping people to get out of that shame cycle and to say, okay, this is my situation, just as you would with any other condition, for lack of a better word. And I love the way Evan just served that up. And I think that's just the other piece of it, is just knowing that the individual makes a big difference, if we can talk and advocate for ourselves.
Brooks, I just want to say that in our panel earlier today, we had 3 doctors from, I'm not sure if they were all from, there were 2 from Park City Hospital, and then 1 acupuncturist. All 3 of them said, because we were talking about brain trauma and various effects that go along with that. All 3 of them said, don't trust your doctors. You are your best advocate. If you need to go to 2 or 3 or 4 doctors to find the right person who you feel connected to, who you feel that you can trust, then you have to do that. But yeah, self-advocacy in this realm as well is also key.
I'm so glad that conversation took place, and I'm sorry I missed that. I'll have to go back and read about it, because that is exactly it. The experts are the individuals. Yes. I am an expert on Brooks, and that's a good thing that nobody else is, because you don't want to be. But that is the truth. We do know. And at some point we lose our way a little bit sometimes. For kids, it's hard, especially. They're barely figuring themselves out, especially teenagers, but they still do know. They actually do. And we as parents and teachers and whatever role we have in the community, we can get that message across, which is, yes, we need help. And so it's an individual's journey that requires assistance from other people, and not the other way around, if that makes sense.
Absolutely. Thank goodness that has shifted in my lifetime. You know, I grew up thinking I don't know what I'm talking about because I'm not a doctor. Well, sure enough, I finally realized in my late 30s, I do know what I'm talking about and nobody else does. So we're like Evan said earlier, small changes, small changes. All right, Betty, I'm going to ask you one last time if there's anybody else who has a burning question.
We have a number of burning questions.
Oh, goodness.
However,
Yes.
we need to start wrapping up in order to respect everyone's time. But what I'm going to do with all of these questions is I'm going to compile them, and we're going to see what answers we can find after this panel discussion. And then we'll probably share them in a blog post, or we'll be able to send them out directly to those who RSVP'd, so that you do get your questions answered and we don't have to rush through them. Does that sound good?
Sounds
Great.
excellent. So I just want to thank you all. This has been mind-blowing for me. I just thank you for all the information. Thank you for sharing your deep, heartfelt stories and making yourselves vulnerable for this cause. And I'm just so honored to have been a part of this. So truly, thank you so much. And for the rest of our audience, I wanted to say, if you or someone you love is struggling with their mental health and you need resources, please contact Connect Summit County's peer navigation line. We connect people in our community in need of mental health resources with those who offer mental health services. So on that note, Patty, I will let you wrap up. But again, from the bottom of my heart, this has been an amazing time. And I appreciate you all being willing to be here and sharing.
Thank you, Julia, and thank you to our absolutely amazing panelists. This was definitely eye-opening for me. And I just want to share this information with everyone. This is our peer navigation information that Julia just alluded to. So please reach out. This is not a hotline. If you are in crisis, please contact crisis services, which actually we will be discussing in depth tomorrow at 10 a.m. on our next panel discussion. So please join us for that from 10 a.m. to 11:30.